Well, welcome. We will go ahead and get started. In the interest of time, I know everyone is very busy. We really appreciate you all joining us for today's public forum, The Fertility Journey, Understanding Options and Navigating Care. I'm Katie Schubert. I'm President and CEO of the Society for Women's Health Research. And SWHR is the thought leader in promoting research on biological sex differences in disease and improving women's health through science, policy, and education. SWHR science programs identify research gaps and address unmet needs in diseases and conditions that exclusively affect women or that disproportionately or differently affect women. Nearly 1 in 8 couples have trouble getting pregnant or sustaining their pregnancy. Navigating fertility treatment can be complex with significant emotional, physical, and financial stressors, and women tend to bear a disproportionate focus and burden in treatment and management. We are pleased today to have 3 distinguished panelists joining us to help better understand fertility options for women. Dr. Tarun Jain, Associate Professor and Medical Director at the Northwestern University School of Medicine, Davina Finkhauser, co-founder and executive director of Fertility Within Reach, and Barbara Kulura, president and CEO of Resolve, the National Infertility Association. I'd also like to thank the sponsor of today's event, Gerbe. Today, as always, we are live tweeting our webinar. We invite you all to use the hashtag SWHR Talks Fertility on social media. And at this time, I would like to introduce SWHR's Science Programs Manager, Carolyn McPhee, who is moderating today's forum.
Thank you, Katie, and welcome everyone. SWHR's fertility program was established to address barriers to access and reduce health disparities related to treatments for infertility in women. We have assembled a working group of patients and patient advocates, clinicians and fertility specialists, researchers, and healthcare decision makers who are committed to reducing the burden of infertility and improving care for women seeking fertility treatment. With the guidance of these experts, SWHR has developed 2 resource guides around women's fertility health care. The Clinician Resource Guide was created to assist healthcare providers as they work with patients to navigate their fertility planning and treatment. The Women's Resource Guide was created to help women and their families understand their fertility options, from creating a reproductive life plan to fertility evaluation and treatment. We are pleased to share that both of these resources are available on the SWHR website. Today, we have 3 members from our working group here to highlight some of the content in the resource guides and to share takeaways from a closed roundtable meeting held this past fall that sought to identify gaps in research, clinical practice, policy, and education, as well as some of their professional and personal insights on the topic. Following the speaker presentations, I will be moderating a discussion with all of our panelists, so we invite you to use the Q&A box to submit questions throughout the event. Without further ado, we'll start with Dr. Tarun Jain, who will speak about the fertility journey from planning to treatment and disparities in fertility health care. Thank you, Dr. Jain.
Great, thank you so much. I'll just wait for the slides to pop up. Perfect. Great. Well, thank you so much. It's really an honor to be part of this amazing group. And thanks to Society for Women's Health Research for putting this together. If we can go to the next slide. So infertility is a very common problem. 1 in 11 women have trouble getting pregnant or staying pregnant, and 1 in 9 men experience infertility as well. So we either have experienced it ourselves or know a close friend or family member who has, and it's really a major problem with a lot of stress and anxiety associated with it. Broadly, infertility is defined as the inability to get pregnant after 12 months of trying. And the caveat to that is for women 35 and older, 6 months of trying. And that brings up the important point of age, which there's a lot of misconceptions around the impact of age on female fertility in particular. Some of the key things to be aware of are that whatever eggs women have, they're born with. Women, unfortunately, don't make any new eggs. So as age increases, the number and quality of eggs go down. And that fertility curve looks something like around the age of 26, 27, fertility starts to clinically go down. And around the age of 34, 35, that curve gets steeper downward. And between 40 and 44, that curve flattens out, the fertility curve. So age is extremely important in assessing fertility. Some of the other important risk factors to keep in mind, if there's a history of infections or pelvic inflammatory disease like gonorrhea or chlamydia, or a history of an ectopic pregnancy, there could be some damage to fallopian tubes. So if such a history exists, you want to get in sooner with your physician to talk about it. A history of irregular menstrual cycles can be indicative of a condition called Pcos, or polycystic ovary syndrome, which is extremely common. It's one of the most common endocrine disorders in women. Nearly 8 to 10% of women may have this. So if you have a history of infrequent irregular cycles, again, seek help sooner. Endometriosis is also extremely common. 5 to 7% of women experience endometriosis. It's commonly associated with painful menstrual cycles. So if such a history exists, same thing. And also thyroid dysfunction, very common in women in particular. It can lead to irregular menstrual cycles and an increased risk for miscarriages. So seek help sooner. Next slide, please. There's a common misconception that was around for a long time that fertility is just a woman's disease or a woman's problem, but far from the truth. It in fact affects men and women equally. So it requires assessment of the couple, not just the woman, if it is a couple indeed. So a third of the time there's female factors, a third of the time there are male factors, and a third of the time really it affects both men and women. On the female side, it could be issues with ovulation or issues with the uterus or damage or blockage of the fallopian tubes. For men, it could be issues related to sperm quality or function or production, issues with ejaculatory dysfunction, as well as environmental factors. So very important. Next slide. As far as the assessment for infertility, it's really quite straightforward. It's nothing scary or daunting. Really involves us getting a detailed medical history, a gynecologic history, a reproductive history, male history as well, if there's a male partner. And there are some tests that we run. So one involves a blood test to check for hormones. We have ways of assessing egg reserve. There could be tests such as FSH, estrogen, anti-Mullerian hormone, or AMH. As far as assessment of ovulation, if it can often be done just by history alone. If a woman has very regular clockwork menstrual cycles, that's indicative of ovulation. Women also often can do home urine LH kits. And if those are quite reliable, over 90% reliable. And if those are regularly positive, that's a good indicator of ovulation. Or we can also check for serum or blood progesterone levels in the luteal phase. A higher progesterone indicates ovulation. Part of the assessment also requires looking at the uterus and fallopian tubes, and the gold standard is something called a hysterosalpingogram, or a HSG. That's where we put a little bit of liquid in the uterus and do some x-rays to look and make sure that liquid goes through the fallopian tubes. The other way is to do a 3D ultrasound with a little bit of water in the uterus. That's called a saline infusion sonogram. As far as the male side, we really want to do a semen analysis. Very important. Like I said, half the time they're male factor issues. So semen analysis. And then sometimes we do some additional blood work from a standpoint of pre-pregnancy testing, for whether it be blood count or immunization history. The other sort of key thing to keep in mind is roughly about 15-20% of the time, all the tests do come back in the normal range. And we call that unexplained infertility. There could be other hidden factors. And the good news is almost all of those couples go on and have success through various treatments. We'll go to the next slide. And this comes into the treatment options. So fertility treatment does not have to be scary or daunting. There's a misconception that fertility treatment means IVF, but that's really not the case at all. In fact, the majority of couples that we see don't do IVF or don't need IVF. Usually much simpler, easier, and less expensive methods are very effective. And that could range from some medications to boost egg production or ovulation if ovulation is an issue. Things like clomiphene citrate or letrozole are common treatments. They're just pills for 5 days. Sometimes we have to use stronger medications called gonadotropins. Those are also referred to as injectables. If there are uterine factors or tubal factors, there could be a need for simple surgeries to assess or correct those things. Then there's something called IUI, intrauterine insemination, which is taking sperm and washing and concentrating it. And in the office, the sperm gets inserted inside the uterus around the time of ovulation. So that can be very effective for mild sperm quality issues, cervical issues, or just improving the timing. And then IVF, of course, is also part of our treatment armamentarium. That involves taking medications to grow more follicles at one time, and then through a simple 15-minute procedure, we can extract eggs, assess egg quality, attempt to fertilize them in the lab, and then place an embryo back inside the uterus. And we also have things like donor eggs and donor sperm available. So for women of advanced age, where their egg reserve is depleted, we can use donor eggs, where the uterus does not age. So even at advanced ages, through use of donor eggs, we can achieve a successful pregnancy. And for men with poor or no sperm, there's donor sperm. Also for single women or same-sex couples looking to conceive. So donor sperm is very commonly used. It's also important to keep in mind some of these treatments can take some time, so it's important to start early. We'll go to the next slide. Lastly, I just wanted to address that there are some challenges in our field. There are disparities that do exist, and this is why we're doing forums like this to better highlight those disparities and help ameliorate them, thanks to efforts from SWHR, Fertility Within Reach, who you'll be hearing from, as well as Resolve, which is the gold standard for advocacy in our field. Fertility is not always covered by insurance. And so some couples do have to pay out of pocket for treatments. And that's something that we're actively trying to advocate to get rid of so that all insurance companies provide coverage. But currently there are several states in the US that have required employers to provide fertility coverage, comprehensive coverage. So those are highlighted in blue, and there's continued work and advocacy and process to further increase this so that all those states look blue eventually. There's also a lack of uniform education in the fertility space. And this is again why SWHR, ASRM, SART, Resolve, Fertility Within Reach, these organizations are really trying to be active in getting everyone to understand the challenges with fertility and get in early. There are also various cultural and religious beliefs that are out there and stigmas associated with fertility. Those are challenges we all have to work on and break those barriers down. We can work with all kinds of backgrounds and religious beliefs. We again, IVF is not something that is required by any means. Most couples have success with much easier, less invasive treatments. The last thing is through research, we're finding that their outcomes do vary based on patient race and ethnicity. We're learning more and more that Black, Hispanic, and Asian women tend to have lower success rates matched for age compared to Caucasian women. So this is active research that we're currently working on, trying to understand why that's the case and try to eliminate those disparities. So my last message is really, it's super important to be proactive with regard to fertility. I encourage all men and women to meet with their doctor in their early 20s, just to better understand and educate themselves on fertility and be prepared, and don't just take it for granted, and make a plan for reproduction early. I will end there. Thank you so much.
Wonderful. Thank you for that overview, Dr. Jain. I'd now like to invite Davina Fankhauser to share her journey with fertility and how it has tied into her passion for advocacy work in this space.
Thank you very much. I'm so grateful to the Society of Women's Health Research for inviting me to participate and organize this great group. And I love the resources that you've developed with the team that you brought together. Can go to the next slide. I'm going to share a bit of my journey and give some tips that I'm hoping will help you. My infertility journey lasted for 12 years before I had my daughter, and it can have an impact on your quality of life. At least it did mine. So I'm going to be very open and honest and share with you what it was like for me. So if perhaps you're feeling this way, you know that you're not alone. And it's been some time since I experienced this, as I now have somebody who celebrated a sweet 16 a couple of days ago, and my son's about to turn 14, but I still feel it all. From time to time, it does come up. Those lifestyle restrictions, I was one of those patients who was going to do everything humanly possible to make sure, you know, I would have no regrets, no questions if there was anything else I could do to try to have a baby. So, you know, I wasn't drinking alcohol. I was changing my lifestyle, limiting the amount of and the type of cold medicine. I didn't take ibuprofen. Some of these things I just heard and I did. So I now know it really would have been okay if I took Tylenol when I was having my, my endometriosis menstrual cycles. So I kind of put myself through pain unnecessarily. But I went through lots of counseling because I had a significant amount of losses, recurrent miscarriages in my journey. And I would be diagnosed with situational depression because I was just so heartbroken that once again, the child I was so desperately wanting wasn't going to happen. We did our holidays and our vacations. We were saving every penny for fertility treatment because we didn't have coverage. So we camped. And thankfully, we lived in some beautiful places and camped and saw things we would never have seen. But it was always a reminder that we weren't necessarily doing this camping by choice. It was just trying to make the best out of having no money. There were times where I literally had to heal physically. A miscarriage to me is your body going into labor to pass the pregnancy, and that can be painful, and your body needs some time to heal, and the emotional pain that can go along with just infertility in general, let alone the specific symptoms and side effects you were having. There are challenges and there were successes along the way. So we had no money, as I mentioned, because we were saving it all for treatment, and we lacked timely and appropriate health care. It turns out I had 10 pregnancies and I have 2 children through IVF, but I needed to have even basic diagnostic testing, and it just wasn't covered by insurance. And what we later found out is that I had a blood clotting disorder. And if I had known that and had the timing of a blood thinner, it likely wouldn't have been that I wouldn't have had 8 losses. And the appropriate care, it wasn't there because we didn't know what exactly needed to be dealt with. So of course, this then added stress and strain to our relationship. And in the end, my marriage didn't last. It wasn't because of infertility, but in the end, when we were discussing about whether to work it out or not, my ex-husband had said to me, there's just been so much pain in our relationship. And he was right. I couldn't deny it. And it took a toll on our communication, and it just, we still co-parent, and we have these wonderful kids, and we have this respect for each other, but we did lose our connection. And one of the things is that some of the decisions we made weren't necessarily the best ideas. So we made treatment decisions based on financial concerns, and it really prolonged our journey and our heartache. You can go to the next slide. But we have 10, I had 10 pregnancies, 6 IVFs, 4 clinics, and 2 amazing children. I call them my gift from God and assisted reproductive technology, because I absolutely needed assisted reproductive technology to have these 2 wonderful, beautiful human beings. You can go to the next slide. So I have some tips for you. Find the good from the bad, because we all know there's bad associated with infertility. To find the good can be challenging, especially when you're feeling emotionally charged going through it all. I personally found the experience of advocating for others so they wouldn't have to go through what I experienced to be the most fulfilling. I felt like it put a purpose to my pain, and it fills me with such joy and pride to do everything I can to help others have access to fertility health benefits, whether it's working with your employer or with your legislator, or filing an insurance appeal and trying to get those benefits you deserve. To me, it is definitely the good from the bad. The community that I've established, if you can find a community to know you're not alone, to be there when you really need someone, that can be incredibly powerful and empowering. Having perspective and just keeping faith that this is a period of time in your life, and you aren't an infertile person, you are a person living with infertility, and you're going to do your best to move on to the next phase in your life, and that next phase will come. And purpose, for me, I'm dedicated to science, because I think research and studies that supports advocacy, that supports the science of assisted reproductive technology, and it improves the care that's available to patients. So I'm a big believer in communicating. We have a section on our website about communicating with your employer, with your physician. I think communicating with your physician is a huge empowering moment for you. Because think about this, if you're going to advocate for yourself, it's just practice when you're advocating for others in the future, whether it's your child, your partner, a parent. So I kind of went from novice to the interviewer. By the time I spoke with the 4th clinic, I basically interviewed the doctor and said, well, this clinic says this and this doctor says that. Which one would you do? And I found a great doctor who said, well, I wouldn't do this and here's why, and I wouldn't do that and here's why. This is what I recommend and here's why. And I was like, I love you. You are the doctor for me. You have to figure out what you need from a doctor, and to be able to ask the questions, even if you're uncomfortable. Doctors don't want you to proceed with uncertainty. So it's okay to make reaching out to the assistant, to the doctor, ask your questions so you can make an informed decision, because you want to live without regret. And it takes a village. You just have to learn to trust them. Trust your gut first and foremost, but also believe that the doctors do have a good plan for you. Next slide. So you should feel comfortable and empowered to ask as many questions as you want. Like I mentioned, here are some sample questions. What's the process to diagnose? What is your experience with treating infertility? I looked at the bios of doctors to see who specialized or did research in endometriosis and recurrent miscarriage. What are my treatment options? What are the risks and the benefits and the success rates? I once asked my fourth clinic, I asked the doctor, after I had my 2 kids, I said, what are my chances if I go for a third? And he said, well, before you came here, your chances were 0%. Now you've been pregnant every time. It's really hard to say, you never know, but you just have to decide if you're willing to go forward, not really knowing that exact percent. How long should you, until you can expect results? If you do get pregnant, what happens next? What resources can you recommend? I hope when it comes to finances, they refer you to Fertility Within Reach, but you never know. Next slide. There are lots of great resources out there. Considerations for your fertility health care. Try to create a shared decision-making process between your partner and your doctor. And it's not just about getting pregnant. It's about having a healthy, safe pregnancy and a healthy baby. To me, that's the bottom line. And your decisions and choices in your plan can help you achieve that. So cause and duration of infertility, family planning goals, age of your partner, all of these things should be considered when you are making your plan. Just have great communication with each other, including your healthcare provider, and you're going to be able to move forward with fewer roller coaster ups and downs. Next. There are, as I said, lots of great resources that are out there to help you. You can see this list. I happen to love, I would say my favorite advocate of all is Regina Townsend of the Broken Brown Egg. I think her voice represents the infertility patient perfectly. And there's no one I love to hear more from. She also wrote a book called Make Infertility Make Sense. And if I was a patient, that is probably the only step-by-step guide that I might need. But I also loved The Infertility Journey, which I realize now was written by Dr. Jane, who you just heard from. I love this resource. So I think it's fantastic for you. Great organizations out there. I put them in alphabetical order. But some of my favorites, I have to say, for information, Pregnantish is fantastic. For programming, Resolve New England, the Cade Foundation. Resolve is fabulous with advocacy. I highly recommend the Advocacy Day. And then for social media, there are lots of great reproductive endocrinologists out there who are sharing lots of information that I hope you'll follow and take advantage of. I hope this information is helpful to you, and I wish you the best in your journey.
Wow, well, thank you so much, Davina, for sharing your story with us. The way you speak about the highs and lows of your journey is truly inspirational. And before we move on to our final presentation, I do just want to share a quick reminder again that we encourage everyone to use that Q&A box at the bottom of your screen to submit questions at any time. So please feel free to go ahead and do that. But next, I will introduce Barbara Kulura to talk about accessing resources for your fertility journey.
Hi, thank you. Hi, everyone. I'm Barb Kulura, and Resolve is really pleased to be a part of this process with the Society for Women's Health Research. And we've worked with the Society for many, many years, and just a big fan of the work that you do and appreciate that you took on this topic. Next slide. So this has been touched on certainly by Davina and by Dr. Jane, the issue of accessing care. And when we think about barriers to care, we think about anything that might get in the way of your ability to access the medical care that you deserve and that you have a right to here in the United States. Those barriers might be geography. It might be that a clinic isn't close by or a specialist isn't close by. It might be that the particular practice that you want to go to isn't on your insurance plan, or maybe the insurance that you have doesn't cover any access to any kind of specialist. So all of those kind of barriers certainly impact your ability to get the care that you need. In fact, there's even some barriers that are legal regarding how people build their families here in the US. So certainly we know that these barriers exist, but there are actually ways that you can help get yourself into the care that you need and really fulfilling your dream of parenthood. So I want to give you some hope because you certainly have heard that there are barriers out there. First and foremost is, if you are on a health insurance plan, is to review that well. Oftentimes those plan guides are big, thick documents with very tiny font that is quite hard to understand. Certainly you can talk to your employer, and you can get on the phone with your insurance carrier and ask some questions specifically about the diagnosis and also what is covered in terms of medical treatment for infertility. Oftentimes people have insurance coverage, and quite good insurance coverage, to tell you, in other words, to diagnose that there might be a problem, but then they don't actually provide you with the coverage for that care. It may actually be that you do have that coverage, and because you haven't needed it, you didn't know it even existed or was there. So start with that. There are some states, as Dr. Jane noted, that do have laws that have been passed that say certain employers in this state must cover infertility at this particular level of benefit. While we know that 19 states have some level, really only 11 of those 19 have coverage that includes things like IVF. So it might be that you're in one of those states. Unfortunately, those laws don't cover every single employer. They cover certain types of employers. So it might be that your state is in your employer is in one of those states, and then you would have access to some of that coverage. There are actually organizations and nonprofit foundations that give out grants. They help people with their medical treatment. They even help people cover the cost of an adoption. Many of these are family foundations. Some of them are listed on the Resolve website. You can certainly Google them, but it might be that your clinic, that physician that you're seeing, has information on financing options and what these foundations may be able to help you with. They really do fill a nice gap that exists, and I hope that that you seek out what those foundations are offering and how you can apply. There's also assistance programs through the pharmaceutical manufacturers, and even the pharmacies have special assistance programs. So please ask your employer, ask your doctor, ask the folks at the clinic. You can certainly go online and see what might be out there that fits in with your needs and how you could access the care. In other words, don't automatically assume that you're going to, as Dr. Jane said, need IVF, but don't also assume that you will be paying out of pocket. We have seen just in the last few years, a tremendous number of employers voluntarily adding this coverage. And so it's super important for you to know what benefits are available to you and how you can maximize those particular benefits. I also want to just give you a little tip. If your employer does have a benefit for IVF coverage, maybe it's a dollar amount. And for example, they might say, we're going to give every employee up to $20,000 of access to whatever you need as it relates to infertility care. In other words, you decide how you want to spend that $20,000. There are ways that you can really maximize that amount of money. For example, it might be actually more cost effective for you to pay for the pharmaceutical side of it, in other words, your medication, out of pocket, and use one of those assistance programs, and then use that benefit for those medical costs. So your out of pocket is less than it might be, and you're not eating up all of that $20,000. So again, there are some smart and creative ways to even maximize a dollar cap benefit that might exist for you. Next slide, please. One of the tenets really that Resolve was founded on in 1974 is the need for support, the need for connection, and the need for community when you're going through this infertility journey. Davina certainly touched on that community and those folks that were around her to support her. Resolve was founded by a woman who was going through her own infertility journey, and she was a nurse by profession and knew the power of support groups. And she started one right around her kitchen table. She met women in the waiting room at her OBGYN office and others, and they started to gather on a regular basis to share their experience and to support each other. Guess what? Here we are nearly 50 years later, and Resolve is still hosting support groups all around the country. Certainly you can find support through things like Facebook. There are specific websites that have private groups where you can connect with others who are in the same sort of scenario as you. We highly recommend the access to mental health professionals. There are actually mental health counselors and therapists who specialize in infertility, pregnancy loss, and adoption. The American Society for Reproductive Medicine has a directory of mental health professionals, as does Resolve on our website. And these professionals are really able to hone in on your particular journey and the challenges you're facing. I know I speak from personal experience from my own infertility journey. Connecting with a mental health professional, quite honestly, just saved my life and the journey that I was on at that time. And I can't stress the importance of finding your tribe. Who is in your entourage? Who are the people that you have surrounded yourself with that will lift you up and that will support you on your journey? Look, the infertility and family building journey is one that is filled with a lot of pitfalls, a lot of decisions that need to be made, and a lot of stress. And I urge you to respect that journey and to take care of yourself. I know we all think we can do this. We're strong. That's how I felt until I was at a point where I really needed help to even make decisions about the next steps. And that's okay. That's not a sign of weakness. It's a sign of strength to be able to recognize the support and help that you need and to get it. There are certainly advocacy organizations as well, and there's faith-based organizations if that's of comfort to you as you go through this journey. Next slide. So you've received a lot of resources during this webinar, and I've grouped them through the support and advocacy organizations, some clinical resources. I want to make sure that you know what the doctors are saying, and that's going to be the American Society for Reproductive Medicine and the Society for Assisted Reproductive Technologies. And then there's some sites out there, some websites that have educational resources. And I urge you, to go to a breadth of places to look for information. I also want to say that it's important for you to find that community that really helps and supports you. But as Davina mentioned, you may feel the need or desire to give back. And that might be in the way of support and mentoring others on their journey. That might be in the advocacy arena. Resolve has literally thousands of volunteers around the country that host our support groups. We have volunteers who advocate, and we have an opportunity coming up in May where the entire community, professionals, patient advocates, and family members come together, and we advocate to our members of Congress about the need for additional research in the area of infertility and the causes of it, and also for coverage. There's our active duty military, our veterans, our federal employees. None of them are covered by a full spectrum of care, and we know private employers aren't as well. So there's huge opportunities for us to raise our voice, to come together, and to advocate as a community. And if that is something that appeals to you, I encourage you to reach out to us and find out more. I can guarantee you that it will leave you feeling empowered and leave you feeling some sense of control over what is an otherwise uncontrollable process. So I hope that you're able to do that. I think that's the last of my slides. Let me just make sure. But I hope that you get inspired and also find ways to not give up as you go through your journey to reach your resolution. We are here for you, as are a number of organizations, to support and provide you with the resources and community that you deserve.
Wonderful. Thank you so much. These were all great presentations. I'll now ask that you all turn on your cameras, which you did quite quickly. So, so as we get together, I invite again, just one more time, if you are on the line and would like to submit a question, the Q&A box is at the bottom of your screen. Feel free to submit them now and throughout our discussion the rest of the webinar. I'll get started with a question that we have ready. So managing fertility care can often be challenging for patients in terms of feeling educated and informed, treatment options, long-term care. I know that we just saw 2 slides with a lot of links on them from Davina and Barb. What do you recommend for women who have just started out on their fertility journey? What should they do first to get started?
Davina, I'll let you go first.
Okay, well, I would say check in with themselves and figure out what it is that makes them better or feels stronger. And if it's identifying that they could use a community, then it's looking for a support group. If somebody's more internal, then I would say pick up Regina or Dr. Jane's book about the infertility journey and making infertility make sense. I think though only an individual can know what's going to help them feel better. I know people want to be told what's the next thing to do, but it's really hard to just have a cookie cutter response because not everything works for everybody. So I think it's acknowledging what you need and then taking some steps to get it.
Yeah, I would say to ask questions, to really ask questions of your provider, whether that's an OBGYN, if you've been referred to a reproductive endocrinologist, to take the time to ask a lot of questions and feel as if you don't need to make those decisions until you feel that you've gotten the information that you need. I also want to just say that in our experience, there's no one journey and there's no one path. So when you hear from other people and you hear their stories, that's super helpful. And it helps you realize, oh, there's a question there that I hadn't thought about. But don't feel like you've got to compare yourself to others and to what others are going through, because every person's journey is different, and we have no 2 patients are the same. And so I would just say that. Last thing I would say is it's not a linear journey. And so, for example, you may feel really good emotionally and you're feeling empowered and so forth. There may be a point in your journey where it it takes a turn that you hadn't expected. And so check in with yourself throughout this journey and be able to say, how am I feeling now? How am I feeling about making decisions? If you are with a partner, find moments to check in with each other. Where are you at? Where am I at? There's a psychologist who told me many years ago, no two people are in the same place at the same time. And because you think that you should be. And that's really not what the data shows and not what the experience shows. So appreciate that, so that you are checking in and ensuring, are we still moving forward with this? Are we taking a break? Where are we both at in our mindset? So, those are some of the things. I know some of that is more down the road, but it's a journey that is going to try you, but also it's going to potentially change over time.
I will just add, I agree with all of that, that wonderful advice. I would also just add that have a focused visit with your doctor early. Like, it shouldn't be one of those things that you just casually bring up in a general visit, because there's just not enough time in a general visit for a doctor to address it. So have a focused visit with your OBGYN early, just to talk about reproduction. And if that's not satisfactory, ask for a referral, because I think a lot of people often get stuck and don't get to the next step or get there too late. So know that there's fertility specialists that are focused just on this. And it doesn't mean you have to get any treatments. It's more of just initial advice and coming up with a plan, a game plan down the line if needed. So it's just great to get that initial advice early enough. And then there's also avoid Dr. Google, which as Barbara and Davina were talking about, there's a lot of misconceptions out there and lots of stuff that's just not true either. So that can really add to that stress and anxiety component. Reproductivefacts.org, that's a great resource from ASRM for just good factual advice as well.
Wonderful, great advice from all of you. Thank you. We do have a submitted question here that is directed towards Davina, but if others have other thoughts to weigh in, that's great. Thank you so much for sharing your story. I'm currently an undergraduate student looking to work in reproductive health. Is there anything that you wish that reproductive healthcare workers or doctors would do differently?
I wish they would advocate more. I wish that they would get involved as much as they possibly can. I think it does multiple things. One, it communicates to the patient that the science and the care and the access to care is a priority for them as well. I think it also can help prevent some physician burnout. When you are working in a field where there are being political decisions made that can impact the work that you do and the care you provide, I think by taking action and being more involved in advocacy can keep you connected and engaged with the science. And I think advocacy is just very fulfilling. So I do wish that doctors and workers would become more involved in that field. I think in terms of patient care, it's really just, if you don't have an answer or you feel that a patient is left wanting more, provide the good resources so they don't go to Dr. Google, provide them with Resolve or Fertility Within Reach or Pregnantish. There are so many resources out there to help patients. If it's not in the doctor's wheelhouse, then help the patient find where to go to get what they need. That's it.
Wonderful, thank you. Okay, this question I'll post to the group so you can jump in if you think you have an answer. This person lives in a semi-rural area where the only reasonably accessible fertility specialist has been less than helpful in terms of getting timely and appropriate testing and care. Any tips on how to best advocate for yourself in this type of situation where just finding another doctor isn't really an option. Oh, Dr. Dean, it looks like you're on mute. Yep.
I can talk about that. Yeah, that can be challenging for sure. But one of the things now, because of COVID, a lot of us have moved to the telehealth platform. So it's actually really simple to have another consultation with another fertility physician who may be in a different state altogether or miles away. So I'd encourage finding another center that you've either heard about or that you know of, and just set up a telehealth consultation with another fertility specialist and run your whole story by them. As Davina talked about in her journey, back then there probably wasn't telehealth, but now it's a beautiful thing. So you can easily get several opinions without leaving your home, and run your story, and we'll be able to go through your details and give you advice on, hey, maybe try X instead of Y. And then you can ask your fertility specialist if they'll be willing to try that different pathway.
Great. That's such a good point, that telehealth has really become much more of an option in recent years.
Yeah.
This question seems to be coming from a researcher. Are you aware of any national fertility patient registries? My experience as a patient and researcher has me questioning whether we have enough real-world evidence to support some of the statistics used to set expectations on success rates of ART. A registry could help fill these gaps.
I can answer that. So there is an interesting way that ART has been captured. There's been a congressional mandate that the Centers for Disease Control and Prevention track the outcomes of every single ART, which is in the United States right now, is pretty much just IVF cycle in the United States. And they collect that information from the fertility clinics, and then that is published for public information by the CDC. The Society for Assisted Reproductive Technology, SART, also does the same thing with their members, which is a slightly smaller subset than what the CDC does. So there is publicly available data on the outcomes. You can look at data by clinic, you can look at data by age, by what kind of treatment they had. So that is one set of data that is available. I work for a patient advocacy organization, and patient advocacy organizations are very well known for doing patient registries. And we don't have one in our space. There isn't that what you would call the real world evidence from a patient perspective on what they tried, how many cycles they did, what insurance they had, what kind of support they received. And so that is a gap in our space, in our field. There has been one attempt that I know of a patient registry that was funded by a grant. It was at an academic institution several years ago, and it just never really took off. So it's a gap and a hole in this space, in this field. As I mentioned, we do have the ART. But if somebody perhaps is not doing that, or it certainly doesn't tell the story from the patient perspective, that is missing.
I'll just add to that. I sit on the SART executive committee, and I've been on their research committee, and I'm currently on their practice committee. And SART for the last 30 years has been collecting and publicly reporting all ART outcome data, as Barb was mentioning. But more importantly, for the past 30 years, they've been doing research based on that data set, and have published probably well over 200 research papers asking and answering all kinds of research questions and outcome data based on all of that information that's been collected over the years. So it's been an ongoing process, and there's tons of really great research that's come out of it that has helped improve our practice. As an example, now mostly single embryo transfers are being done thanks to the guidelines published by SART, showing that we don't need as many embryos to have a successful outcome. So that's been one of the great successes, where success rates continue to improve, but the multiple rates are very minimal. So there's been a lot of good information from registries like that. So sart.org is a great place to go.
Great, thank you. And we are running a little bit short on time, so I'm going to combine two questions that are maybe not super related for you, Dr. Jane. One of them is, I've heard of the term ICSI. Is that a common procedure? And then the second question is if you have anything that you can say to natural techniques for fertility.
Yeah, so ICSI, we call that ICSI. That's a common acronym. So it stands for intracytoplasmic sperm injection. It's actually a laboratory technique that's used in conjunction with an IVF procedure. It's, in simple terms, it's basically the lab can take literally one single sperm and insert it into an egg under a high-powered microscope. So it's really advanced technology, and it's primarily used for couples where there's some sort of a male factor condition, where we're trying to overcome any sperm issues to try to pick the better sperm. And it could be issues related to fertilization or even poor egg quality. So right now, I think about 70% of IVF cycles are utilizing that technique as part of IVF. And then the second question, can you—
Natural techniques for fertility.
Yeah, I think one of the key things to keep in mind, one of the great tips, I think, is the fertile window. I think couples try to figure out, okay, when's the right time to conceive? The ideal time is actually about a 5-day window, starting the day before you expect to ovulate, up to the day of ovulation. Intercourse around that 5-day window, every other day is the same as every day, so it doesn't have to be every day. Tracking with urine ovulation predictor kits is a great, simple way to figure out when you may be ovulating. I think those are just some common questions that do come up, and so those are simple tips.
Great, thank you so much. So before we wrap up, I'd like to pose one last question for each of you to give an answer to. Given that our webinars attract a diversity of patients, researchers, clinicians, policy professionals, industry, what is one takeaway each of you would recommend to viewers to help them support or improve fertility health care for women? And maybe we'll start with Barb and then pass to Davina and end with Dr. Jane.
Well, I would just take the infertility journey very seriously. I would recognize that this is a disease and that there are millions of people who are struggling and aren't getting access to the care or the support that they need and deserve. And so there is a tremendous opportunity to change the status quo for people who are struggling to build their family. And we all hate it when we hear people think of this as a lifestyle choice or that we brought this on ourselves. And those are horrible myths that have to go away. And we all have to come together and recognize that there are millions of people who are suffering, and we can really work to support them in a meaningful way.
Carolyn, I'm sorry, can you repeat the question?
Yes, of course. So knowing that there's a wide variety of stakeholders in this audience, from patients to industry to policy professionals, what's your one takeaway that you would want to share with them so that they can help support or improve fertility health care for women?
I would say the takeaway for them is to figure out how they can participate, how they can make this field more accessible. How can they support patients? How can they support each other? I think I always say, we're in this together. There's a huge group of us out there. We all have the common goal. How can we come together and really make a difference? I think everybody does make a difference every day. And I think individually that's significant, excuse me. But when we are all connected and working together as one, which I think is probably why I love Advocacy Day that Resolve and ASRM put on. It's probably my favorite day. It's the day where everybody comes together for that common goal and they have an opportunity to step up and make things better. So I would encourage people My takeaway is to figure out how they're comfortable to step up.
Thank you. I would say do not take fertility for granted. I think I see so many patients, I've seen so many patients for the past 20 years, and the common theme that I keep hearing is, I wish I had known about fertility and age and so on. I would have done something differently. I would have started early. I would have learned more. I think a lot of people just think that, well, whenever I'm ready, it's going to happen. Easy, no big deal. So just don't take it for granted. I think start early, learn, educate yourself, empower yourself as a patient. Just, get the right resources. There's so many great resources we learned about today, including the one that's being put together by SWHR. So learn and empower yourself as a patient early, be an advocate, communicate, talk to others. You'll quickly realize it's everybody all around you has dealt with this in some way or the other. So avoid becoming a patient, be an advocate, and learn and create a plan for yourself. Just be proactive.
Wonderful. Well, thank you all so much. We are out of time for our panel, unfortunately. So I will say thank you again for your time and insight. And we'd also like to thank Group A for their support of this public forum and SWHR's fertility program. We could not do this work without the expertise and contributions of our science networks, particularly the fertility working group members who contributed towards the development of SWHR's Women's and Clinician Resource Guides to Fertility Health Care. We will send out an email with a recording of today's webinar to all registrants, as well as the links to our fertility resource guide, so please be on the lookout for that. To all those watching, we invite you to connect with us on social media and visit our website, www.swhr.org, to download our fertility and other resources and to sign up for our newsletter. Lastly, we encourage you to continue this important conversation using the hashtag SWHRTalksFertility. Thank you so much for joining us today. Again, thank you to our wonderful panel, and everyone have a wonderful rest of your day.